Good afternoon, everyone. I can see that a few of you are being admitted from the waiting room. Thanks for waiting a minute or two out there. We will be getting started quite soon on Water at Wayne. Again, for those of you just entering, welcome to Water at Wayne. We'll be getting started in about 2 or 3 minutes. We usually like to wait till a little bit after the hour to get started. All right, I think we can go ahead and get started. I know there are still a few people coming in from the waiting room. But we're just going to start by going over a few housekeeping items and to once again say welcome to everybody who's here for Water at Wayne today. Just a few housekeeping tips. Participants, all of you that are signing in right now, you are going to be muted initially when you come in. We're going to ask that you keep your videos off during the event. But later, if we have, hopefully we'll have time for some questions. And when you ask your questions, we will really want to have you have your video on, but we think it might be a little bit better if during the event your video is off. Also, depending upon what Dr. Pete wants to do, normally what we do is we hold questions until the end, but during the presentation, if questions come to mind, we'd suggest you put them in the chat box. And Jamie and I will be monitoring the chat box, and if there's something that we think kind of is so pressing that we need to stop Pete, we'll do that. Otherwise, we'll bombard him with those questions at the end of the presentation. So, without further ado, I would like to introduce our speaker for today. Dr. Pete Larson is an environmental epidemiologist interested in issues of climate, environmental justice, and health. He received his PhD from the University of Michigan in 2013 and has worked on numerous public health projects around the world, including Malawi, Tanzania, South Africa, and Kenya. Currently, his work has brought him back to the United States, where he is focused on environmental determinants of physical and mental health and health disparities in his home state of Michigan. He also plays and promotes music from around the world, and you can do that for us on another Water at Wayne. So very happy to have you here, Pete. I've really enjoyed getting to know Pete over the last year or so, and I know he's got a lot to share that will be of interest to our Water at Wayne audience. So Pete, go ahead. All yours.
Well, thanks a lot, Carol. And thanks, Jamie, for making this happen. And thanks to all of you for being here. This is really a great opportunity for me to interact with all of y'all. So I very much encourage everyone to put questions in the chat while I'm going along, and certainly after it's done, I'm hoping that we can have a nice conversation between all of us. So today, what I'm going to be talking about is part of the work that I've been doing with Carol and Jamie and other partners at Wayne State and Center for Urban Studies and Health of Urban Waters and U of M Dearborn and the University of Michigan on flooding in Detroit And specifically, I'd like to talk about the what's, where's, and who, and how water threatens the public health in Detroit. And see how this works. So in last June, when we had extremely heavy rainfall and there was flooding in Detroit, you might remember, this was what we saw in the media on what was going on in Detroit. We saw pictures like this, pictures like this, and pictures like this. And to me, as a public health guy, I found this somewhat enraging, for lack of a better word. I mean, it's sort of presented that flooding is this sort of, inconvenience, to, people traveling along highways or whatever. And I think what's often forgotten in this whole conversation is that flooding is in fact a very, very serious public health issue. It's definitely about more than cars flooded on the highway. Like if you look flood Detroit, this is what you see. And for the experience of Detroiters themselves, things are very, very, very different. And so what I would like to talk about today is the specific health implications of flooding. And I want to do that using results from a survey that was conducted over the past decade or so. So first, what I'd like to get to is about the what's of flooding, the specifics of flooding in Detroit. There are different types of floods. There's not just one kind of flood. There's things like river floods, flash floods, man-made floods, coastal floods, pluvial floods. But what happens in Detroit is a specific type of flooding known as urban flooding. And this happens as a combination of excessive rainfall and of infrastructure that becomes overwhelmed by that rainfall and ends up diverting water back into the city itself. And of course, the specific outcomes of flooding in urban areas are peculiar to urban areas as well, just by nature of how cities are constructed and what societies are like there. So that's really the type of flooding we're specifically focusing on here. As we know, climate change is increasing the frequency and intensity of extreme precipitation events around the world. And some of this is due to the warming of the globe and excess water, evaporating from the oceans and into the atmosphere and creating a larger burden of moisture in the atmosphere that has to come down at some point. But in terms of flooding and the impacts of those extreme precipitation events, these disproportionately impact urban areas due to factors such as low elevation, since most cities are constructed along waters, specifically for the purposes of use of ports for trade, proximity to water like Detroit, and particularly here in the United States, aging water infrastructure. Detroit also, on top of all that, has particularly complex social and economic dynamics that exacerbate not only baseline risk for flooding impacts, but also exacerbate the worst long-term impacts of flooding. And then that's sort of the aspect that I'm interested in personally. So there's, in place like Detroit and urban flooding, there are two different types of flooding. There's river direct rainfall flooding. So water comes down, can come into your house, from above. And there's also sewer backups, as we found this past June. Many people, not everyone, but many people reported, water backing up in their home through a sewer outlet. And of course that comes with, things like fecal waste matter, environmental contaminants in some situations. In Detroit, problem is that residents suffer from both types at once. So because y'all are on a low elevation and close to the river, and truth be told, like Detroit is located on an area that was traditionally swamp, and was sort of coaxed into allowing human existence. And also because of Detroit's aging infrastructure and its combined sewer outflow system, rainfall and sewage are diverted through the same system, so that rain precipitation comes down, it's diverted out into the river, but that same system also diverts sewage as well. So you can see when the system becomes overwhelmed, sewage comes into the home. So in Detroit, extreme precipitation events lead to water entering the home from both above and below. It's really from both ends at once, which is one of the most concerning aspects of it. There's a couple people waiting to get in the waiting room. Yeah, okay. But when we look at flooding risk to individual homes, we're really talking about 3 different levels of risk and 3 different levels of factors that contribute to risk. The first, of course, is weather and in the form of rainfall, heat, cold, wind, snow, all these different things. These are sort of these giant exogenous factors that determine flooding within an urban area or a place like Detroit. There's also environmental spatial risks from aging infrastructure, flood zones, water proximity, location of the home itself. But then also related to that are specific household factors. So the type of housing that you actually live in, the condition of the homes, the condition of your roof, the condition of whether you have your sewer outlet capped or not, cracks in the basement, all these different kinds of things. So I think that you can think about Detroit as being sort of grossly impacted by all 3 of these factors at once, and why that makes this such a serious issue for a city like Detroit. So you've got, all of these factors all at once are sort of encapsulated in this issue of environmental justice and why people live the places they do, why the infrastructure is the way it is and why the housing is the way it is. And I don't think it takes much imagination to visualize and understand, as you all do, the great disparities between residents of the city of Detroit and outside the city of Detroit and what the history is there. So this is really one of the the major topics that I'm interested in personally. So flooding impacts, not only are there different types of flooding, but in terms of floods, the outcomes of floods themselves, they also follow sort of different paths and patterns. And so flooding impacts to human health and well-being are multifactorial. And this has been shown from research all around the world, not just in Detroit. There are sort of immediate hazards of extreme levels of water in the streets, or rainfall coming down and coming in through your roof. But then there's secondary hazards as a result of that. And so these can be things like injuries and mortality that happen in the short term because people are trying to get themselves or their possessions out of harm's way. Primarily at this stage, the most likely to be injured younger males, or men in particular, sort of trying to plug up dams or prevent water from coming in the home, move items out of the home, move their families out of harm's way. But then after that, there's short-term outcomes, and these can include things like outbreaks of infectious disease, exposure to environmental contaminants, and things like animal bites. I grew up in Mississippi and experienced severe flooding back in the late 70s, early 80s. And it wasn't uncommon for snakes, for example, to be deposited in your neighborhood and create fairly extreme hazard for snake bites. One neighbor of mine found a small alligator in their home after a flood. So that's not uncommon as well. And stray pets, all different kinds of things. And finally, are the long-term impacts. And so these can come in the form of exposure to constant levels of molds or bacteria, leading to or exacerbating chronic health problems. And we're going to talk a bit about asthma later in the presentation. But places like Detroit, already have baseline challenges in terms of public health and flooding and the resulting mold and microbial growth in the basement exacerbates these already existing problems. And one aspect that I think is underappreciated are the long-term psychological impacts. of flooding. These can result from, disruption. I mean, having all your life completely disrupted by incoming water, destroying all your possessions, or causing you extreme economic damage is devastating for many people. Instability in terms of housing. Where do you live after your house has been inundated with water? Can you continue living in that place if you've got sewage in your basement? And also the knowledge that flooding events come suddenly and without warning, and could occur at any time. And these lead to things like PTSD, long-term anxiety, and even suicides. So what I want you to sort of take home from this slide is that flooding is not just a simple inconvenience of flooded vehicles on a road, but actually has very, very serious short and long-term implications. And I'm more interested in these issues of health, respiratory infections, skin wound infections, and also long-term mental and physical impacts. So flooding is a constant in Detroit, as we have found. It experiences acute and extreme flooding events like this past summer or back in 2014, as we all remember, where extreme precipitation leads to large amounts of water in the city and impacts, large amounts of people all at once in a very dramatic fashion. But Detroit also experiences regular pluvial flooding during normal rainfall events, and part of that is due to its sewer outflow system that leads water backing up back into the home, or things like cracks in the basements, or plugged sewer outlets, or a number of other things. So Detroit is experiencing not only above and below, but also acute flooding, and also regular flooding, and flooding, at least in my experience interacting with people in Detroit, some people sort of accept it as normal, that you have a constant, 1 or 2 inches of water in your basement. And to me, that's not only abnormal, but unacceptable. So the impacts of both types of flooding are exacerbated by the same factors, things like low elevation, proximity to river, aging infrastructure, poor maintenance of water inlets, poor housing conditions, and inability for residents to mitigate their own flooding risk. And so, I mean, as you know, in Detroit, many residents, especially elderly residents, lack the financial resources to do things like make simple improvements to their house to prevent water from coming to the home during a regular rainstorm, or don't have the money necessarily to repair the roofs, leading to even small amounts of water coming in the home, leading to mold growth, which presents risks to human health. So this is not only a problem of flooding is not only a problem of economics, but it's also a problem of the economics as they play out in terms of public health. So to me, flooding is sort of the underappreciated, constant, everyday disaster that's going on within our region. So both these types of flooding, acute and regular, contribute to a host of health risks. Constant presence of moisture in basements leads to constant exposure to molds, opposed to serious risk to respiratory health. Psychological impacts. I mean, nobody's happy about having water suddenly come in their home or regularly coming into their home. Economic losses, which lead to downstream impacts to health. If you blow your savings trying to repair your home after a flood, you're not going to have much left over to do things like pay for sudden medical expenses. Worsened housing conditions that in fact make a bad problem even worse. So these problems are compounded on one another. And I think there's a question in the chat. In your opinion, who should be held responsible to compensate these individuals and families for the damages and financial loss they have faced? Perhaps the city, state, private institutions, et cetera, or even a combination. I think that's a great question. Who pays for this? That's always a great question. Who exactly pays? I can think of some important candidates, but um, I think one of the ways that we can approach this is approaching the impacts of flooding not just as an issue of property, but also an issue of public health. And so, for example, if we're going to have, medical insurance schemes, to protect people's health, like things that were expanded during the ACA, we should also consider flooding and other natural disasters as a public health problem, and steer some money to provide things like housing improvements, knowing that those things do in fact work to protect the public, protect that person's health. So as far as who pays, that's a very good question. But I think it's going to take sort of a rearranging of how we approach things like housing quality. I think we need to view housing quality as a public health issue. And that's something I don't think we do enough right now. I hope that answers your question. And when we get to the Q&A session, I very much appreciate hearing everyone's opinions about it, because we all have something to say. So this is getting to the research that I've been working with partners at University of Michigan, U of M Dearborn, and importantly, Wayne State University, and people at Healthier Waters and the Center for Urban Studies. And that's the wheres. Where does flooding happen in the city of Detroit? So the Center for Urban Studies at Wayne State has been studying hazards at homes since 2000. They conduct what we call home safety assessments that includes sort of basic questions, not only about home safety overall, but also about flooding. And during this round of surveys that occurred over the course of a decade, it was found that individual homes, 45.7% of the homes surveyed experienced basement flooding due to heavy rains or water leaks. 33.7% of them experienced sewer backups, which led to a total of 62.6% of all households surveyed reporting at least one kind of flood, if not both. And that's incredible. I mean, the homes in the survey were not targeted because they had been flooded. They were just chosen at random in a survey. And without even making flooding a major question in the survey, it was found that nearly 2/3 of homes in Detroit in the survey were flooded, and that's not only incredible, it's to me unacceptable. That's 2/3 of homes in Detroit that are experiencing what could be a major public health risk. I mean, I don't think that, other cities can claim that, like Ann Arbor, where I live, it's definitely not the case for sure. And I don't think that's the case in the suburbs. I don't even think that's the case in Grosse Pointe, which is on the water. I mean, this is Detroit. So, I mean, you can imagine how this plays out. So what the survey does is it goes around to different neighborhoods. Like, for example, this is the Jefferson Chalmers neighborhood, 48215. And ask the people in the house if they are willing to participate in the survey. If they say yes, they go on and administer the questionnaire. And then the address of the home is recorded, and then we're able to take that address and convert it into latitude, longitude coordinates, which allows us to do things like create a map like this. So for example, on the left here, we have the points, the households that reported having a basement. And then on the right here, we have the households that reported water leaking into the basement in Jefferson Chalmers. So we're able to use this data, the addresses, and then the resulting latitude, longitude coordinates to specifically locate these households within the city of Detroit. So what we found was we had 4,803 households surveyed between 2012 and 2020. And this survey is ongoing. It's still going on right now, all throughout the city of Detroit. Our main hypotheses in this research were that flooding events will be concentrated in specific areas. The housing conditions and socioeconomic factors and neighborhood characteristics will determine flooding risk for individual homes. and that it won't just be one thing, it'll be a combination of a lot of things. So this is what we found. Every dot represents a household in the city of Detroit. The red dots are households that said, yes, they had been flooding. And this map in particular, I thought was really incredibly compelling. Obviously this is a sample of homes in Detroit, but you see that people all over the city have been flooded. So not only did we find that 2/3 of Detroiters had been flooded, we found that flooding was occurring all across the city. And of course, this is a sample, it's only, nearly 5,000 households out of all the households in Detroit, but it gives us a pretty good idea of where this is occurring. It's not just houses along the river, it's everywhere. We ran some fancy statistical analysis that allows us to identify sort of statistically significant clusters of houses that have been flooded. So what that means is areas of extremely high risk for flooding. So where the chances of a household being next to another household that had been flooded is very, very high. You can think of that like, for example, in terms of these were done, for example, in, crime statistics, where they're trying to find specific areas where crime is extremely high, or, studies of cancer where you're trying to find areas where cancer rates are a little bit high. So we applied the same methodology to flooding. So what we found was this. We found that Jefferson Chalmers, no big surprise there. It was a high cluster of flooding. We found a high cluster out here. The red is very high risky for flooding. We found one here and a couple of neighborhoods up by 8 Mile, up by Highland Park and Hamtramck. The blue are areas of low risk for flooding. And we're going to talk a little bit about why this might be in a second. But what this told us is, yes, flooding is happening all over the city, but in fact, there are areas that are extremely high risk for flooding. So what I want to talk right now is about who is impacted by flooding, because we did get information on these households in the survey. Okay. Looks like somebody is drawing on the slides. Is that me? No? Okay.
Hey, Pete, really
Yeah.
quickly, we got a question in. Did you do any surveys in the suburbs for a comparison?
Okay. Yeah. So first there's someone drawing on the screen. I don't know what that is, but if you could look at that, Jamie. Did you do any surveys in the suburbs for comparison? No. And that's a great question. The Center for Urban Studies is focused on the city of Detroit, which is really great. But I think that like doing surveys on some of the suburbs and even downriver would be an excellent thing to a project to embark on, to get some comparative information on flooding and the specific determinants of flooding. So yes, I think that's a fantastic idea, and especially downriver, I would be really interested in that. Do you know that? Go ahead.
One more question. It said the previous map showed a lot of red in 48217 zip code. I'm not sure which zip code that is off the top of my head, but the following map didn't show anything statistical. So sorry, go on.
48217. I'm embarrassed to say I don't know where 48217 is. Maybe someone can point that out.
So 48217 is that little chunk right in the southwest. Yep.
Down by Ecorse and Melvindale.
Yep.
There is some red there. And as to why that wouldn't show up as a significant cluster, statistically, there's lots of reasons why that might be. There could be diversity within that neighborhood in terms of the local clustering of homes. That would be something to explore. these significant clusters are sort of meant to sort of inform in a broad sense, where, we might focus efforts if we were to focus efforts. But I sort of want to take it home that flooding is something that is impacting all Detroiters, and I think we need to take a holistic view of it. So that's a great question, and one that definitely deserves attention for sure. Do you know the number of homes Wayne State has surveyed since 2000? That was 4,803 in my data set. The data set was given me. So there might be more, but it's around 5,000. 4,803 answered the flooding question. I hope that helps. Okay, these are awesome questions. Please definitely feel free to put things in the chat or send questions to Jamie. I really appreciate that. So the who's. So a survey was included in the larger survey on housing conditions and different aspects of the home. And we looked at things like, does the person own or rent the home? And what we found was that renters are at significantly higher risk for flooding than people who own their homes. We also found that the age of the home was important, and there's a little more nuance to this than what this table shows that I'm going to show you in a subsequent slide. Homes that are slightly older were at slightly lower risk in this, but there's a little bit of nuance to that. I'm going to get into it in a subsequent slide. The size of the house didn't really impact flooding risk, but unfinished basements were more likely to be flooded than finished basements. So this rent versus own was quite informative to me. I think that things like targeting landlords to maintain or upgrade their homes or make routine repairs would be not only a good way of sort of improving the property profile of the city, but also would be an excellent means of protecting the public health for obvious reasons. Year house built, we found was that it wasn't as simple as saying that older households were at high risk or newer households were higher risk. What we found is that if we look on the x-axis here, this is the year the house was built. And if we look on the y-axis here, this is the probability of flood. So what are the chances of a home experiencing flooding? What we found was that very old homes, those built in the 19th century and the early 20th century, are at high risk for flooding. But then this risk goes down to houses built during the war years, and then back up again for houses built more recently. And this was interesting to me. And this could say something about the quality of house, built in the post-war years versus the quality of house built recently. It could also say something about where houses are being built. But this was an interesting outcome to me because it wasn't just simple old versus new. We were seeing people that were experiencing flooding that were living in homes that were built in the 21st century. Housing conditions, we found that everything was predictive of flooding in the home. So mold on walls of basement, of course, if you have flooding, you're going to get mold, but basement repairs, an unrepaired basement was 12 times higher to experience flooding than a repaired basement. People with roof leaks were 2 times higher to experience flooding than people without roof leaks, window leaks, chimney leaks, plumbing leaks, foundation cracks. All these things indicative of houses in poor repair were indicative of flooding in the home. So better built houses and more well-repaired houses, even in this context of extreme precipitation and infrastructural challenges, are more protected than houses in poor repair. So this tells us a lot about where we need to target funds to prevent people from having water in their homes. One way of, certainly we have to, address our infrastructural problems, but we also need to address this issue of housing quality, and considering repairing homes and ensuring good housing quality as a public health issue, as a way of protecting people's public health. Census tract poverty, under 18 poverty, African-American population, these things were not necessarily predictive of flooding. And part of that is because Detroit is a predominantly African-American and predominantly poor city. And so, just in terms of data, it's difficult to assess these differences when most people in the data set fit those profiles. But we did find that percent of homes owner occupied within the census tract, a higher percentage of owner occupied homes was protective against flooding. So again, this brings back this issue of rentals versus owned homes, and why we might need to target landlords to improve housing to protect their tenants' public health. So how does water and flooding threaten the public health in Detroit? Well, one is that Detroit's asthma profile is among the worst in the country, and possibly among the worst in the world. The prevalence of current asthma among Detroit adults is 29% higher than the state of Michigan as a whole. Hospitalizations for asthma are 3 times greater for Detroit residents than for Michigan. And that's even given, poor access to healthcare and health insurance. Rate of asthma hospitalizations for white persons in Detroit is 35% less than the rate for Black persons in Detroit. The rate of emergency department visits among children covered by Michigan Medicaid was twice as high in Detroit as for the state as a whole. Reliance on emergency department for asthma care was 50% higher for kids enrolled Medicaid with persistent asthma in Detroit as compared with their counterparts in the state at whole. So even asthmatic kids in Detroit do significantly worse than asthmatic kids outside of Detroit. And things like this plot, which is from the NIH, this is population adjusted asthma rates for different race and ethnic groups in the United States. And I mean, this is this is unacceptable by any measure, and Detroit is obviously seeing the worst of it. Someone is drawing on the screen again. I don't know what that's about. Asthma and flooding. So what we found in our survey was that 74% of people in our survey reported having at least one adult person in the home who received an asthma diagnosis from a healthcare professional. These are people that received a diagnosis. There are lots of people who have asthma that don't understand that they have asthma and maybe just have never been to a doctor and have never actually been, or have been to a doctor and simply have never been diagnosed. So this is actually an underestimate of the actual number of people who have asthma in Detroit. 56% of people with asthma experienced flooding, compared with 47% of the people without asthma. If you were flooded, you're more likely to have asthma than if you're not flooded. Does this provide evidence of a causal link between flooding and asthma? No, we can't do that with this kind of data and with this kind of survey, but it does send off the warning bells, that flooding in Detroit could be one of the reasons that Detroit experiences such a high asthma burden. 88% of adults living with asthma reported having at least one asthmatic child in the home, which is, I mean, that's dire for the future. So not only are asthmatic adults living in these conditions where their health conditions could be made worse, significantly worse by flooding and water in the home, but there's also children in the home who also face extreme long-term poor implications for health. So one just wanted to address future directions briefly, that projects that I'm working on and trying to get going, is looking at how flooding will impact health for other conditions. So this is a map of FEMA flood zones and income, and all the blue around there is the FEMA flood zone. And this to me was interesting because not a whole lot of Detroit is actually covered by a FEMA flood zone, which makes no sense to me. But what we're trying to do is look at these connections between flooding risk and health. And one of the aspects that we're looking at are respiratory deaths and also mental health fatalities. For example, suicide and drug overdoses and alcohol-related liver failure. And asking the question of whether living at risk for flood or having been in an area that was formerly flooded increased risk for these types of mortality. And so, these maps don't, provide, any sort of evidence one way or the other, but this is one of the things that I'm working on presently and want to move forward with. And that's why I thought it was really interesting that someone mentioned doing flood surveys in areas outside of Detroit and suburbs, because, downriver, they are at high risk for flooding down there as well. And, there might also be implications for health down there. I mean, when we look at this map of respiratory deaths, we can see that it's redder down there. So there are more people dying of those kinds of causes down there. So, it might take some looking holistically, not just at Detroit, but also at the entire Detroit metro area, and sort of drawing comparisons between the suburbs and the outlying areas and the city of Detroit as well. And also looking at what, what the shared burden of health risks is as well. So thank you. I just want to say thank you to all the participants in the survey and community partners in the city of Detroit. I mean, without those people, we can't do surveys like this. It's enlightening and encouraging to interact with people on the ground and hear what they have to say and what their experiences are. And also, I want to thank partners at Wayne State University, Carol and Jamie, people at Healthy Urban Waters, and of course, University of Michigan Dearborn and University of Michigan Ann Arbor, the Institute for Global Biological Change at the University of Michigan, and the Fred A. and Barbara M. Erb Foundation. So thank you very much. And we can do some questions and have some conversations.
Thank you so much, Pete. That was very informative. I've seen a lot of this data. I've seen a lot of this data many times, but it's always very shocking to me to see it. Every time I see it, it's always very shocking. So
Same.
Thank you for presenting it. We do have a couple of questions that have come in, and feel free, people, to submit your questions in the chat box. We'll also, if people want to raise their hands, we can also do it that way too. But a couple questions in the chat box. Did your survey differentiate between flooding due to interior drainage issues versus record Great Lake levels?
There was a differentiation between rainfall induced flooding and sewer backups. In terms of how we can tease that out from extreme events versus regular events, we knew the date that they were surveyed, but the problem is that we didn't know the exact date of flooding, so it was difficult to tease that out. So one of the things going forward, is that I think is to not only conduct these regular surveys, but also to sort of motivate boots on the ground to collect data on people's experiences right after floods occur. And that's something that I'm not sure we're doing enough of, and would certainly encourage people to do. Encourage people to give us money to do, like government, please. Not that any of you are in control those things, but if you do, please.
Another question, lake levels caused by flooding in communities along the Detroit River canals in Jefferson Chalmers neighborhood in 2019/2020. I'm actually not sure what the question is. Maybe it's just in reference to that previous question. Tina, if you want to clarify that, you can feel free to jump in.
Can you hear me?
Yes.
Yeah.
Okay, yes, I was just, that was just clarification on my question of record Great Lake levels that led to overtopping and inundation in particularly the Jefferson Chalmers neighborhood that has canals going through it, makes it particularly vulnerable. But it was a question in relation to that survey. Thanks.
Oh.
Okay.
Okay. Nicole Brown had a question. Were these findings concentrated in higher areas of concentrated poverty?
The difficulty with that in the city of Detroit, well, one of the difficulties was that there's not a whole lot of sort of upper class people that are included in the survey. Not because they were unwanted in the survey. We certainly want, to have a nice profile of the city, but participation was voluntary and it's sometimes challenging to get all groups included in the survey. So that was one challenge. Another is that just because of the sampling method itself, since Detroit is so overwhelmingly, economically challenged, that it's difficult to capture better off households and draw those comparisons. So, I mean, is it the case that low income residents, are at higher risk for flooding? I'm pretty confident in saying yes, and that's why I think it's going to be important to sort of expand the reach of some of these kinds of surveys into the suburbs and downriver to be able to definitively draw those kinds of comparisons.
Okay. Bob Burns, you raised your hand pretty early on, so I'm going to give you a chance to ask your question.
All right, thank you, Jamie. Dr.
Yeah.
Larson, I'm with the Friends of the Detroit River, and our organization has been involved in water quality and habitat restoration. And, with the increased precipitation that we've been seeing here over the last decade or so, it's obvious that, that has grave impacts on the environmental side, but obviously the human side as well. One commonality that, that we're well aware of, and many on this call are, particularly with the city of Detroit, is that the stormwater system and sanitary system are basically combined, so that they're basically going into one set of pipes to be processed. And obviously, when you may mention about seeing, the streets and the highways flooded, but particularly when you're looking in the neighborhoods, and the first thing you look at is the streets out in front of these homes that are flooding are backed up with water, which tells you that the storm drain systems are not functioning properly. So, and obviously, that backs up the house, and certainly, the repair, the how well the house is kept up, or, the basements and things that can prevent water from coming in are another factor. But the point I'm getting at is that, having to deal with the infrastructure is something that's critical in order to relieve a lot of this flooding in the city itself. You mentioned about, and the question was, well, how does that impact, say, farther into the suburbs? Well, if you go down into, parts of the Rouge watershed, and particularly getting into E-course, now you have some separated systems. You have more stormwater that goes directly into the water streams, these creeks. But the problem is, and somebody alluded to, the river's been higher the last few years. You got backup in that sense. You've got all this water coming down into the watershed, and it's just basically backing up through the stormwater systems from the creeks back into the areas there. So in a sense, you have a problem there. So I guess the point I'm getting at, we look to, okay, we have two things that we can do here. Number one, we can somehow spend money and increase the conveyance of this water away from the homes and through the systems that they have to get through. Two, we can try to reduce the amount of stormwater that's getting into the system so that it doesn't back up. But from our point of view, it's kind of a double-edged sword, because we are concerned about the water quality aspects of it and the impacts that it's having to the local creek systems, and then the impact on the river. So we've kind of come to the conclusion that there's a number of things that need to be done depending on what part of the, the type of infrastructure you have. And number two, I think you need to understand that, if you look at the historical, geography of this area, we had a lot of wetlands, we had a lot of conveyances, we had a lot of natural ways of getting, this water to the river, which we've lost. And I know we've noted that in particularly some of the tributaries, somewhat on the Rouge and certainly Ecorse Creek and others, if there's a way to try to increase or reestablish some of those coastal wetland areas, or those areas that would absorb and allow for overflow into a control manner, as opposed to backing up into the residential areas like that. So I guess I'm kind of throwing out that aspect of it. It's more of a mechanical kind of approach to it, but you can see the implications it has for the things you're talking about. So really, you've got to figure out how to deal with that problem. Obviously, if you could get funding and help people fix up their homes and do that, that would help. But as long as they've got water backing up to their basements, it's a tough thing to kind of, to do. So I'm just kind of throwing out a little ramble there, but I think it hits on some points. I like your point on that.
Yeah, I mean, I amen to everything you've said. I mean, like the problem of flooding in Detroit is so complex. It's going to take a lot of people at the table to come up with solutions to this problem. And obviously we have this infrastructural problem. We can part of that is sort of wetlands restoration as well. But the point I'm trying to drive home is that not all the flooding that Detroiters are experiencing is because of flooding, coming up through the sewer or off the streets. Sometimes it's coming in just because their homes are in poor condition. And so, I'm sort of trying to draw attention to the sort of like micro, level problems that can be dealt with as well. But in no way sort of, downplaying, these larger issues that you're talking about. So, amen to everything. And we need to all sit down.
And as you mentioned, infrastructure, and we know we've just had a large infrastructure bill passed on the federal level. I know there's a number of things that are working through the state. How do you see if any of that money is coming through these various sources can be used to tackle some of the things you're talking about? Obviously, we've got a concern about the infrastructure side, but you make a great point about, people need help to try to do what they can do on their own properties. So I've got to believe that somewhere in this whole scheme of funding that we're trying to get monies for a lot of different things, I would think somehow if people can band together, because I know the legislative people, I spoke to, state and federal legislators that are having flooding in their jurisdictions, and they're coming to what can we do? What can you help? Your organization works with these kind of things. How can we help? How can I help my constituents to take care of this flooding that's devastating their properties and their communities?
Yeah, and that's why I think that part of this is maybe we need to generate some more awareness that there's a human right to a safe place to live. And that's going to take sort of two approaches, is putting money into solving some of these infrastructure problems, but also putting money to provide homeowners or even landlords for their tenants, to improve the quality of housing overall. And so what I'm trying to suggest is perhaps we treat housing and housing quality issues as a public health issue, and make that part of our discussion, that we have when we talk about things like, health insurance or like, expanding access to medical care. That's, I think that like we need to sort of like take reassess the way we approach some of these things and approach some of our, societal problems and challenges, and start looking, more as a whole, and understanding how these things impact individuals as well. So thank you for your comments. Those were really awesome.
We have a question that's kind of similar to that. It's how do you suggest Detroit starts combating its flooding issues? What's a good first step? So you kind of touched on that a little bit, but
oh my God.
I don't know if there's one single first step.
Yeah, I don't even, I mean, you know, I hate to say, I don't even I know what would be first, right? Now this is part of the, you know, the sort of problem with a problem as complex as flooding in Detroit, and why this problem exists is because, you know, the problems are so multifactorial and so complicated that it's difficult to know, you know, to know where to start. And from a policy perspective, that's a real challenge, you know, because policy likes to focus on, you know, specific actionable things. And none of those things, like in isolation, are going to solve the entire problem. That's the issue we're in. You know, solving the infrastructure problem doesn't solve the problem of poor housing. You know, solving poor housing doesn't solve the problem of infrastructure. And then there's all these other issues as well. So yeah, I wish I had a good answer for that. I really do. I mean, as a public health guy, you know, I'm, you know, of course, you know, going to advocate for, you know, things that work to protect the public health. But yeah, sorry to say, I don't have a specific answer for that. I wish I did.
Yeah. I want to briefly say, I see a lot of questions coming in. So we're
Cool.
going to try to get to as many as possible by 3:30, but whatever ones that we don't get to, I'll summarize and send to Dr. Larson, and he can answer them. I also want to, I'll drop it in the chat box, but Dr. Larson also said that he could, if someone wants to ask him directly, email him directly.
Yeah, 100%. I mean, if anybody wants to email me directly, you know, Jamie will send out my email, and you can just write me. I'm, you know, happy to engage. You know, I love hearing from people.
Cool. Okay, we'll get to the next question. So Irma brings up a really good point. So Detroit also has high levels of PM 2.5, high usage of cigarettes, and with older homes, there's, you know, dust exposure. Those could all contribute to high asthma levels. And then are those things being, you know, is that being taken into consideration? The data presented here that suggests that flooding might just be causal.
Yeah, in terms of asthma, asthma is a complex health problem that to be honest, I mean, there's no consensus on what exactly causes asthma. We know that lots of things can make your risk for asthma higher. And those things can be things like, you know, mold in the basement. It can also be, you know, smokers in the home. It can be smoking itself. It could be dust, and it can be mites. It can be lots of things. And unfortunately, as the commenter, you know, rightly points out, all of these things exist to an extremely high level in Detroit. I mean, smoking rates in Detroit are much higher than the rest of the state. You know, poor housing has, you know, more implications than just water in the basement. You know, there's also exposure to air pollutants, you know, from industry and you know, from cars and whatever. So, and that's one of the things that makes, you know, studying, you know, respiratory health outcomes really challenging. Because there's just so many things that cause, you know, the development of these chronic conditions, and it's difficult for us to tease out which one of these things might be more important than the others. But, you know, again, you know, they're all important, and you know, it's going to take a lot of, you know, a lot of proactive work on the part of, you know, public health people. And this is one of the things I keep coming back to, right? Is like, you know, we have to treat things like, you know, housing quality as a public health issue, because it is one part of it. You know, we obviously have the medical component to asthma. You know, we obviously need to figure out how to get people to smoke less. You know, we need to figure out, you know, how to get, you know, factories to stop polluting as much, you know, how to reduce air pollution in the air, how to deal with flooding, all these different things all at once. And I think that like any sort of policy thing in the United States, you know, essentially boils down to this issue of public health. And it's a huge challenge. And I think that the commenter appreciates that as well. You know, that's 100% true.
Yeah.
So I'm going to stay on my soapbox about that for a while.
I think that's a good takeaway from this event as a whole. Okay, here's another question. Have you thought about collaborating with Windsor? So, you know, in Canada, we also have a problem with flooding on this side of the border.
I would love the opportunity to collaborate with Canadian research groups. Yeah, 100%. Because, you know, Windsor too, you know, it's a shared risk.
Yeah, particularly with from the Detroit River. Obviously maybe the sewer backups it's going to be a different conversation, but
Yeah.
um,
But I mean, that's good for generating comparative, you know, informative comparisons. You know, what works over there?
yeah.
You know, what works over there that we're not doing? I mean, I don't know. And that would be an interesting thing to find out.
Yeah. Here's another question. Any plans to run future models based on climate scenarios or assessing ability to adapt where flooding is most likely?
I personally, I mean, that's obviously something that someone should work on for sure. You know, maybe Carol, you all have some plans for that. I mean, I personally, interested in climate stuff and looking at, you know, how day-to-day changes in air pollution or exposure to, you know, pollens or other air allergens like impact risk for development of respiratory conditions. And that includes, you know, outcomes in the city of Detroit as well. So yeah, I am working on that. What am I talking about? Yes, I am working on that.
I'm gonna do one more question, and then I see there are lots more questions in addition
That's
to this.
amazing.
So I will I'm gonna summarize all these and send these to you if that's okay. And then
Please do.
I'll when I send out the link to the seminar following, I'll have all those questions and Pete's answered.
And Kami has had their hand up for a while.
Yeah, let's get to her because they've had their hand up for a while. So Kami, I don't know if you want to jump in here.
Thank you. Thank you, Dr. Larson. This was a very interesting lecture. I appreciate it. I'm a professor of urban planning, and so I appreciate the planning related complexity and also the health issues. And, you know, housing should be a human right. And I agree that we should take a broader health perspective on this. I meant to ask you this question about, you know, you talked about targeting landlords several times. And I think, of course, that's very important. But as you said, this is multifactorial. And I wanted to piggyback on the question about the aging infrastructure and the fact that, you know, we have a combined sewer stormwater system. And there are multiple solutions, you know, daylighting drains, restoring wetlands, restoring the absorptive capacity of soil, in addition to all the other infrastructure and other kinds of solutions. Is that I guess I have several questions. One is there a possibility for looking at what solution might be optimal, you know, in terms of actions, priority of actions in particular neighborhoods, based on how, you know, what the dominant factor is? That's sort of one question. The other thing is, I appreciate the interdisciplinary, the importance of interdisciplinary approaches to solution. You know, we need to take a health perspective, we need to take an insurance perspective, but I want to emphasize history. You know, it's the federal government's actions that created the suburbs with the highway and the
100%.
mortgage investment and so on. And
Right.
that facilitated the, you know, the great difference in wealth. You know, housing is an important source of wealth. And it's because of that, we're seeing such disparity in wealth between suburban white households and inner city African-American households. It
No
is a
doubt.
historical legacy issue, I think, that needs to be emphasized in addition to all the other sectors we're talking about, whether that's infrastructure and planning and health, economics and insurance, and so on. The history cannot be underestimated in this.
A resounding agreement. Like there's no, I don't think there's any way to dispute that. Although I'm sure people would try. And that's why, you know, I think that's someone, you know, making the comment that we need to do surveys like this out in the suburbs is important, you know, because that will help sort of uncover, you know, these historical differences. and also perhaps, make the case that there is shared risk here, that the problems of Detroit, do in fact impact the suburbs as well. I mean, as we saw, this past June, the flooding out in Grosse Pointe. And yeah, I mean, 100%, we need to talk about, how we got to this point, why we're here, and make the hard conversations about what we can do about it. 100%.
Can you respond to the
Absolutely.
practical question about if there are particular strategies that are more optimal in
Yeah.
specific neighborhoods?
Yeah, like as in our survey, we found that, not all neighborhoods in Detroit are the same. Like for example, the Jefferson Chalmers neighborhood is really a sort of obvious example of that. That there's no other neighborhood like the Jefferson Chalmers neighborhood in the city of Detroit, and so it's going to take specific types of efforts, specifically targeted to their particular conditions, which are nothing like the rest of the city. So yeah, I think that survey work can uncover these differences and uncover the differences of people's experiences and uncover the differences in the types of impacts that are felt in the different parts of the city.
Thank you.
Yeah, thank you.
Okay, I'm gonna cut, we're about 5 minutes over, so I'm gonna cut us off. I do want to mention, I saw a couple of questions that were related to like resources for people in terms of like people who have experienced flooding or who are just looking for more information. I dropped in the chat a link to a flooding report that Dr. Larson and the group that he's been discussing, the consortium between U of M and Wayne State, this group developed a couple this past summer, actually. So I dropped the link to that in the chat for people who are interested in learning more about that study and learning more about different resources available to them. I also dropped Dr. Larson's email in the chat, and I'll also send that out with the link to the recording of the event. But yeah, I'd like to end this really briefly. Thank you so much, Dr. Larson, for coming and speaking to us about this and for answering everyone's questions. I just want to remind everyone, as I mentioned, a recording of the event will be sent out following the event, probably early next week. And then we don't have any more Water at Wayne seminars this semester, but we will have some more next semester. So I'll be sending out that information. And if you want to, if you're not currently on Healthy Clean Water's email list and you want to be on our email list, feel free to go to our website and sign up, which is, or you can just register for the seminar and click that you want to subscribe to Healthier Clean Water. So once again, thank you again, Dr. Larson, and thanks to everyone who attended. I hope this was very informational for everyone.
This is amazing. Thank you very much. Thank everyone very much. This is an amazing opportunity to be able to interact with everyone. So thank you.
Thank you so much.